Yeah, I'm happy to be presenting at EHA this year, a interim analysis with a data cutoff of April 15 of this year that is examining the oral antagonist Mavorixafor that actually antagonizes CXCR4 along with Ibrutinib in patients with Waldenström's macroglobulinemia. I'm excited about this trial because both the MYD88 and CXCR4 mutation were discovered in our laboratory thanks to whole genome sequencing. And while we've done a lot of work translating the importance of targeting MYD88 through BTK inhibitors in this disease, where we know that BTK itself is activated by mutated MYD88, we have seen so far very little progress being made against antagonizing CXCR4. And I think this is actually one important trial, which I want to talk a little bit about why we're very excited about, this sort of approach. So as many of you recognize, CXCR4 is a receptor that actually signals in response to CXCL12, and it makes actually Waldenström cells traffic to the bone marrow, but it also creates drug resistance. And so if you have some way of being able to block CXCR4 signaling, this might present a way for us to help advance therapy in Waldenström's. And we know that CXCR4 can actually cause drug resistance against BTK inhibitors. So in a previous trial, we had looked at Immuno-Oncology, a CXCR4 antagonist, along with Ibrutinib, and we were actually quite excited by that trial because it showed us that we could get deeper responses faster by adding Immuno-Oncology. Now in this trial that we're going to be presenting at EHA, the potential to do this with an oral antagonist is being recognized. And unfortunately, we don't have Immuno-Oncology anymore. BMS discontinued its development of this program, but we're excited on the other hand that X4 is developing this oral antagonist. And this will also represent ease of convenience. And so I think this is going to be a very nice study, even though it's an interim analysis. It's showing us that the two drugs together are tolerated. We've seen so far that the IgMs go down and that the hemoglobins go up in the patients that are anemic. And so far, every reason to hope that we're going to continue advancing this drug through dose escalation and further observation.